definitely changing the outlook and how things are in terms of the healthcare system in Libya. And when I picked to study prenatal genetics and fetal medicine, that was the main goal that I had in my head, was to prevent so many things that are happening right now due to lack of that's very simple things in our healthcare system that could help lots of people.
You're still an activist, obviously, and you've done lobbying, you've worked with certain ministries, you went to schools. فالموجة هذه يعني you understand well, تعرفي كيف الناس هذه تفكر وتخدم. And it's part of the excitement around this topic for me. لما نسمع prenatal medicine / genetics, I always feel like it's something complex, like you're dealing with. لما تخرجت السنة الأخيرة, the excitement around the genome project, the collecting of data and decoding it was like peak. يعني معظم professors معنا احنا in my engineering department, electrical and computer, they will pay you extra just to sit around and try to be part of this project. It was the fascinating, most exciting thing. 2006, 2007, even maybe a bit before it. يعني. And a lot of my friends who are enthusiastic about this and betterment of health are constantly watching documentaries to find out what could you do. يعني there is stuff that is beyond crazy imaginative that are doing to animals, for example, to something as ridiculous as someone wants to code a fluorescent dog, because there are certain animals that have fluorescent texture, skin, I don't know what it's called, birds, حاجات زي هذه. Someone is working hard to manipulate the genes and codings of a dog to make a dog fluorescent. Obviously, this is far-fetched. There are other uses that are much more immediate and beneficial, as preventing disease or looking at conditions in advance. وهذه الاريا بتاعك انت اللي هي prenatal, which is يعني before a baby's born, right?
Exactly.
This is what it is. What have you learned and what fascinates you within this that could be implemented Libya or حتى on a global scale? يعني?
The scale is very wide when you speak about genetics and genomes and all that. But if we're trying to focus more on the prenatal aspect of things, when I studied here and I've attended lots of clinics and how things work in the system here, there are things that are very simple that could be done, and that they for instance, there's something called non-invasive prenatal testing, and it's a very simple blood test that they would basically find the fetal DNA, which is the baby's DNA in the mother, through her blood, and then they would test it and see if there are certain diseases like trisomies, Down syndrome, and other. I don't want to get so technical, but there are simple things that
بس حاجات common وممكن تأثر في حياة الطفل وحياة العائلة نفسها. Like both sort of affects the baby and the family that are
expecting.
Would you say widespread or common?
In Libya, I've seen it quite a lot. For instance, Down syndrome, it's very, very common, and there are ways that, at least, even if I don't want to get into details of abortion and all that, how.
And what's the importance for that to you? If you know versus 9 months down the line, you just find out قضاء وقدر وخلاص, deal with it. What is the true difference between the two scenarios?
It's the
in your mind, based on practice.
Yeah, it's the preparation, the psychologically that you're prepared and you know what to expect, and you're expecting a baby that has this whatever XYZ disability, and you read up about it, you prepare if there's specific things, school, that here they consider every single aspect of how this baby is going to be brought up and so
and
on.
they tell you and they educate you في المستشفى.
Yeah, they do counseling sessions, you know, with the parents. They talk to them. They get them involved with other parents that have had the same issue, or
so it's not a wait and see situation. It sort of makes people be active about
even like plan, and also with regards to family planning, so they know like the probability of having a certain disease, like even before they decide to get pregnant. So if it's known that the mother or the father are carriers or of a specific disease, they know what's the probability of us having a child that would carry the same gene, or would they be, because some things they're passed on, but they're not, they don't have to be affected. So you could carry it on in your gene, but you don't.
Something you said you worked in Libya a certain period, يعني قبل ما تجي انت medical, your whole period of being a medical student was there. Here it's simply a master's and then continuation of practice possibly. You got exposed to hospitals, how they run things, patients, a lot of conditions. I'm going to repeat that. It's the mail. So while working there, you got exposed to the hospitals, certain conditions, patients, this prenatal thing specifically because you were practicing there. And none of this is applied. There is no family planning aspect. There is no analysis. There is no testing. This conversation isn't there.
No, it doesn't happen
100%?
at all. 100%.
All hospitals, all over the country.
Yeah.
Wow.
Not at all. Unless the only time that doesn't happen is if people have difficulties conceiving, and then at that point they would go to like IVF treatment or
in general hospitals or private?
No, privately. That doesn't exist in public hospitals. And then at that time they know, okay, yeah, we're getting pregnant. So there's another thing which is quite advanced and they do here is if it's known that the parents have a certain condition, they would try to do IVF to be able to test the embryos. So there's something called it's called PGT, so a prenatal genetic testing, and that's done like, so you have an embryo and you can test to see if this embryo carries that condition. So because you've done everything sort of outside, you can see, and then they would, so that they wouldn't do one embryo, they'd do quite a few, and then they'd pick which one is better, and then they'd implant it back into the mother, and knowing that, okay, this baby doesn't have this condition now.
So I guess generally on the cliche point, people will think of us and say the first maybe podcast episode with a female was about getting pregnant, babies, family planning. You know, we didn't talk about kitchen or food yet. We're not. But people already will have sort of big flags to say, this is super cliche. Is it for you?
No, definitely not. Like, honestly, I didn't see myself getting into this field when I first, like, not even when I first graduated. Like, it was something, you know, all the female sort of doctors would go into, like, نساء ولادة, and I was like, no, that's not something I want to do. Then I found myself getting into, even though, like, initially I wanted to do the genetics part of things and the prenatal, and then I found myself somehow like that this field has that part to it as well. So it's all like this big circle of things. It's not one thing. You can't do that part and not do this. So and also like I'm still at the broad spectrum of things. To get into the thing, whichever I decide to get into specifically is another process. And so this sort of opened so many doors, my master's in this course specifically, because it has multiple potentials to it. And there's also the other part, which is like fetal medicine, and that's like the babies and how they develop and so on. So I didn't plan it, I guess, and I found myself really interested.
Definitely. I'm going to take a little detour بعدين نرجع للندن. Next phase, what are you going to do for your future?